before I had my heart attack in 2002, I thought I was pretty healthy. Actually, I was pretty much in denial, is what I was. I was a smoker. I didn't eat healthy. I was on and off the exercise wagon, more off than on. And you know, I've come to learn over the years that all of these things that I was doing wrong and contributing to my demise. The day that I had my heart attack in 2002, it was right before my air shift, and I was going on to do the news, and I was having chest pain in the morning. And didn't want to go to the doctor. I thought it was stress. I went to bed that night, and my chest woke me up at about 11 o'clock that night. Pain that I had never felt before. It was like an elephant sitting on my chest. And all I wanted was for the pain to stop. And they were giving me morphine in the emergency room to deaden the pain. That wasn't even helping. Eventually, once they got me into the cath lab and opened that blockage up, immediately the pain went away and I felt great. And I started exercising, eating right. But despite that fact, even though I was losing weight and I was doing all the right things, because I was prone to restenosis, every 3 to 6 months, I would be back in the hospital to get another stent. 6 stents, 2 brachytherapy procedures where they burn away the scar tissue. That didn't even help. So eventually I had triple bypass surgery. I remember laying in the hospital after the heart attack thinking, how did this happen? And so, being the curious guy that I am, and being a journalist, I'm asking lots of questions. I wanted to find out why this happened to me. Fortunately, the American Heart Association was there. And they gave me a binder full of information. And I asked lots of questions, and they gave me lots of answers. And I figured, look, I was doing nothing right. I better start doing some things right. And so I took their advice and their counsel to heart. And I got well pretty quick, with the exception of the restenosis. Folks thinking, I don't have time to exercise and I don't want to go through all of that. All I have ever done since my heart attack is walk. That's all I've ever done. And I lost 50 plus pounds. And I've managed to keep most of that weight off simply by eating right, low fat, high fiber, and exercising. My strength comes from my faith, and I recognized that God was sending me a message. And I got the message. And I know He is with me every day, every minute, and I call on Him a lot to stay strong. And He also gives me the wisdom to exercise every day. But this is an ongoing life struggle. It's not like you have a heart attack, you have triple bypass surgery, and you're well. This is an ongoing thing. Whatever you do, if you can prevent yourself from developing heart disease, do it, because once you have it, it is a lifelong struggle. And I wouldn't wish it on anybody. But this is what I do wish for. That people who are at risk, if you are not exercising, if you're in a high-stress job, if you work odd shifts, if you don't eat healthful, low-fat, high-fiber, consider making life changes. Because once you develop heart disease, you'll have it for the rest of your life, and it's something that you'll have to deal with until you meet your maker. Just take that from my heart to yours, that you really need to step up. And if you don't do it for yourself, do it for your loved ones. Do it for your wife, do it for your children, do it for the people who love and care about you.
We found out at our 20-week ultrasound that we were going to be having a girl, and along with that came the news that she was going to be born with multiple heart conditions. And in fact, she was born a blue baby, which meant that her body wasn't able to take the oxygenated blood to the lungs.
She had a heart cath the day after she was born to determine what her defects in fact were for sure, because they got a much better picture after she was born. We came to the conclusion that her best options were going to be to have surgery at 8 days old.
She had her first cath post-surgery in September of 2011, and it was determined that things weren't going exactly the way they would have liked to have seen. So at that time it was determined that we would be turned over to a specialist, and we boarded a plane and flew out for her second open heart surgery that lasted
A little over 11 hours.
little over 11 hours.
Tatum's heart doesn't have pulmonary arteries in the manner that yours and mine does. Her blood is carried to her lungs with different blood vessels that you and I don't have. Her last procedure was to, in effect, make those little blood vessels ponytails and then move them to parts of the lungs that need the most blood. We were very lucky. We envisioned that we'd be out there several times. We were able to take care of it in one trip. We were out there about a month. We got home. She was oxygen dependent for about another week. And then we removed the oxygen. And from that day forward, we've had a happy, healthy little girl.
So I think there's a period of time that has to go by before you're ready to step forward and say, this is Tatum, you know, meet our family, this is what we've been through, and however we can reach other families that have been through this or going through this now is exactly what we want to do.
The money that the American Heart Association goes towards research, you know, saves lives.
Saves lives.
So.